We are joined now by Dr. Mishka Terplan to talk about the very timely issue of opioids. Dr. Terplan, it's great to have you here.
Thank you for having me.
So you can't turn on the news or open a newspaper without hearing about opioids. It's something that's going on in the general population. Are you seeing the similar problem with pregnant women?
Yes. Yeah, of course. As opioid misuse, and use disorder have increased in the population, it's also increased amongst women who get pregnant and stay pregnant.
All right. So where do you go with all this? When you're an OBGYN, what do you need to know? What do you need to think about when you have a patient walk in?
Well, I think we need to sort of differentiate use from misuse from addiction.
Okay.
And we need to identify people who have opioid use disorder or an addiction to opioids, and we do that through screening. So all pregnant women, part of routine prenatal care, should be screened, should be assessed for using an instrument or a tool as to whether or not they might have an opioid use disorder. If they have an opioid use disorder, they need treatment. We've known for decades that treating addiction improves birth outcomes. And in fact, the difference between somebody with treated addiction and a general population of people without addiction is really minimal. The biggest risk is untreated addiction.
You mentioned screening, but there's a difference between screening and testing. Talk to me about that.
Yeah, so when I use the word screening, I mean using an instrument, using a tool, asking somebody questions.
Yeah.
When I use the term testing, I mean looking at a biological matrix like urine to detect metabolites of drugs. A urine drug test is not a screening test for addiction.
Can you depend on screening though? I mean, is it the kind of thing that women will be honest with you, or are you going to find that people are going to try to hide it and then you have problems later on?
That's a great question, and I think before launching into screening, I think it's important to ask people's permission. For example, is it okay if I ask you some questions about drinking, smoking, and other drugs? And if the patient says no, you don't ask. But I think asking for permission and respecting somebody's answer goes a long way towards establishing that therapeutic alliance upon which all medical care is built. And for prenatal care, you're going to see people back.
Right, many times.
Yeah, so if you don't ask those questions at the first visit, because she said no, then you can ask again at the second visit, and usually people will be forthcoming.
But if you get that no, is it not a red flag that maybe you need to know?
Not necessarily.
Okay.
I mean, so this is what we're kind of getting at now, is talking about stigma, or which is really just a euphemism for discrimination. So people who use drugs have encountered discrimination from healthcare providers. And they are justifiably, I would say, skeptical sometimes of disclosure, and that's more pronounced in pregnancy due to potential child welfare involvement after birth. So I think we lay the groundwork by, treating people with dignity and respect, using non-discriminatory language, and explaining sort of the bigger picture. We are providers of care. We are not enforcement of, laws, and we are not the police, and et cetera, and to really try and create safe, welcoming spaces.
So is there a protocol though when you deal with opioids, if somebody's been maybe taking it for pain versus somebody who seems addicted, whether they admit it or not?
Yes, so I think you could sort of think of three populations within pregnancy whose infants are, let's say, at risk of developing neonatal abstinence syndrome, which is withdrawal at birth. One is women who are prescribed opioids for a medical condition who don't have a use disorder. Two would be people with untreated opioid use disorder, and three would be people with treated opioid use disorder. So that, differentiating which population of opioid use somebody falls into is necessary in terms of sort of triaging care. Clearly somebody with untreated addiction needs treatment.
Clearly. So you're talking about treatment, but what about, we've talked a lot about during the pregnancy, postpartum.
Yes.
That is a very big issue when you talk about the opioid crisis.
Yeah, so postpartum is a time of increased vulnerability in general. It's where we withdraw care as obstetrician gynecologists. It's where people's insurance shifts, where mood changes happen, and for people with addiction, it's actually a time of increased vulnerability for recurrence, use, overdose, and overdose death. And in the states that have looked at opioids in the context of maternal mortality, overdose death is one of the leading causes of maternal deaths, and most of those happening not during pregnancy, but happening in that 4th trimester.
And
so continuing care is critical.
Question. Very good. That was my question. All right. So what do clinicians need to know today to give better help to their patients?
Yeah, so one, integrating assessment for behavioral health in general across all domains of healthcare, and that includes assessment for substance use, misuse, and addiction. Like, that should be a routine part of healthcare. Two is people who are identified as perhaps having a use disorder or an addiction to a substance, they need treatment. The treatment of opioid use disorder rests on both pharmacotherapy, medications like methadone or buprenorphine, plus counseling. That the buprenorphine can be integrated into obstetric practice. So I would encourage obstetrician gynecologists to get waivered or to learn about buprenorphine and integrate it into practice and care. And I think the third thing is being attentive to the postpartum period, to the unique vulnerabilities of people who use drugs, and to find ways to continue care, through until the first year following delivery. I think those are all key principles.
Dr. Terplan, thank you so much for joining us.
Thank
Excellent
you.
information.
Thank you for having me. My pleasure.
ACOG TV has all the coverage